Parkinson's medications play an extremely important role in caring for someone living with this disease. Each resident with Parkinson's is different. For example, some residents take their medication 3 times a day, and others take it every 2 hours during the day. If Parkinson's medications are not administered on time, it can cause problems for both the resident and the caregiver. Why? Well, medication helps control tremors, movement, rigidity, the ability to walk, the ability to transfer from a chair to a bed or the toilet, or the ability to roll over in bed. If the medication is not given on time, these simple tasks become impossible. Many of the physical and mental problems associated with Parkinson's are caused by the Parkinson's individual not getting the medications on time. Correctly dispensing meds on time will benefit the resident, but as the caregiver, you will be able to provide better support when their symptoms are not so extreme. While there are no therapies currently available that will reverse or slow down the progression of Parkinson's, the goal is to manage and reduce the severity of the symptoms. That way, people living with it can strive to maintain a higher level of independence in their day-to-day lives. Since no 2 people living with Parkinson's disease have the exact same symptoms, treatment varies greatly with each person who receives the diagnosis. We can never assume that what works for one person will work for another. Let's look at the medications used to treat Parkinson's in order to control or manage motor and non-motor symptoms. For more detailed information on these 2 symptom categories, watch the video, What is Parkinson's Disease? As a caregiver, knowing the impact of managing medications properly is crucial. Miss a dose, and it can mean the difference between a resident being able to move or not. So how does the medication work for a Parkinson's resident? Most Parkinson's symptoms are caused by the loss of dopamine-producing cells in the brain. The medications given act as a replacement for the dopamine that's lost. Parkinson's medications work to temporarily replenish, mimic, or enhance the effect of dopamine in the body. Let's break that down even further. The first major breakthrough in the treatment of Parkinson's was the drug Levodopa. When taken, the brain converts it into dopamine, which is stored within the brain cells. Then, when a person with Parkinson's moves, there's enough dopamine available. This medication is almost always given in combination with another drug called carbidopa. Carbidopa ensures that as much levodopa gets to the brain as possible. Working together, these 2 drugs help improve motor symptoms such as slowness, stiffness, and tremor. Carbidopa-levodopa can be taken in a variety of strengths and forms. Tablets can be swallowed, dissolved on the tongue, and even dissolved into water. It's also available in a capsule or a gel pump to the intestines. The most commonly used form of carbidopa-levodopa is prescribed under the brand name Sinemet and is available in immediate release and slow-release forms called Sinemet CR. After administering these drugs to your residents, keep an eye out for any side effects such as nausea, constipation, low blood pressure, confusion, or dyskinesia, fidgety movements that look different from a tremor. With dyskinesia, people with Parkinson's can experience head bobbing, weaving of the trunk, or a turning and twisting movement. Dyskinesia is caused by the progression of the disease, and you see it when a resident takes the medications. It tends to be more severe as the dose of the drug levodopa increases. Amantadine is a medication especially helpful for suppressing dyskinesia. A different class of medication used to treat motor symptoms of Parkinson's is called dopamine agonists. Unlike levodopa, this type of medication mimics dopamine and basically tricks the brain. How does it do that? Dopamine agonists work on dopamine receptors in the brain and fools them into working. Commonly prescribed dopamine agonists include ropinirole, its brand name is Requip; pramipexole, brand name Mirapex; rotigotine, brand name Nupro, which is a patch; and apomorphine, brand name Apokyn, which is an injection. Like all medications, dopamine agonists can have common side effects such as daytime sleepiness, visual hallucinations, confusion, and swelling of the legs. A rarer side effect is a lack of impulse control, such as an increased desire for gambling or spending money, and uncontrolled eating or sexual urges. If you see these or any other side effects occurring in your residents, inform their healthcare provider, so if necessary, adjustments in medication can be made to minimize these side effects. Over time, residents need more and more medication to manage their Parkinson's symptoms. Extending agents are drugs that help prolong the life of the medications. Commonly prescribed extending agents include entacapone, brand name Comtan, and residuline, brand name Azilect. Administering medication on time for each individual resident is one of the most important responsibilities you have when caring for a Parkinson's resident. Parkinson's disease medication effects vary from person to person, but often last only a few hours. The medications must be replenished at a specific time in order for a Parkinson's resident to continue to move and function well throughout their day. The common practice of passing out medications within an hour before or an hour after the time ordered will not work for Parkinson's residents. Now that we've covered a basic overview of medications used for motor symptoms, what about non-motor symptoms that Parkinson's residents experience? Take a look at this list. It represents just a portion of the possible non-motor symptoms your residents may experience. 90% of people living with Parkinson's have one or more of these. You may administer a variety of medications to treat these symptoms. But be aware that treating these symptoms may not always require medication. For example, orthostatic hypotension, the experience of lightheadedness or dizziness when standing up, is a familiar symptom when caring for elderly residents. This can be much more significant in people with Parkinson's to the point that it causes them to pass out or fall. Typically, this happens more as the disease progresses, but it can also be present throughout the course of the disease. If your resident complains of this, always start with increasing their water intake to 60 ounces per day. Increase their salt intake, make sure they're staying active, and when lying down or sitting in a chair, keep their legs elevated to lessen or prevent leg swelling. The treatment of a person living with Parkinson's disease should also include regular exercise, such as walking with them around the facility or assisting them in participating in an exercise class, a healthy diet, time spent socializing, brain-stimulating activities, counseling, and other therapies. Managing medications for Parkinson's residents is part of an overall treatment plan. Keep in mind that Parkinson's medications may have interactions with certain foods, other medications, vitamins, herbal supplements, over-the-counter cold pills, and other remedies. Having a complete picture of each individual's treatment plan, especially giving medications on time, will ensure that you're providing the highest quality care to a person living with Parkinson's disease.